Over the last 2 months here in Harris County, we've been monitoring the exposure to monkeypox. Since the very first case, and really since we began hearing about monkeypox around the world and in our country, we've been trying to be proactive, and especially working through the vaccines that we have, the knowledge that we have, the resources we have, and the community. And the number one message is we're still continuing to do that, leaning forward, working to make sure that we're not catching up, but we're getting ahead of this. Our most powerful tool on this is prevention, and we continue to need the community support on that. I want to start this morning with a piece of challenging news. We confirmed just yesterday that a young child in our community is a presumptive positive for the monkeypox virus. Now, I say presumptive positive because all of our cases are presumptive positives until we get complete confirmation from the CDC. To put it into context, so far we have not yet had a presumptive positive not be a confirmed monkeypox case. At some point that will happen, but so far it hasn't happened. So we are assuming that this will be a confirmed case. It'll take about a week for the information to come back, but we do have a presumptive positive who's a young child. As with all the monkeypox virus cases in Harris County, contact tracing is being done, and we're working to understand the spread of the virus in this situation. The child is currently expected to have a full recovery, is doing very, very well. And here's what we know about the case. This child is under 2 years old. We are in contact and have been in contact with the family, who are fully cooperative. The family has helped us initiate contact tracing with the folks that this child has been in contact with. We are still in the early stages of the contact tracing, so we're not finished. We just began this just yesterday. We still haven't identified the specific mode of transmission, that is, how exactly the child contracted the monkeypox virus. The child has not been in any daycares or school settings, and we're working through the direct contacts the child did have. The child is completely asymptomatic, other than having a residual rash, and the family tells us that other than the rash, that's all they've seen. There were never any symptoms, according to the parents, other than that rash. All of the direct contacts that the child has been in touch with are being offered the vaccine. If anyone obviously is identified as having the virus, they will be directed to treatment, but so far nobody else in the child's circle has been identified as also being a presumptive positive. And so look, this case in Harris County is one of only a handful of cases in young children nationwide. And I understand that it's a very scary thing, and parents have concerns. And what we need to make sure is to be vigilant and understand the risks, not assume the worst, but this reminds us that this is very real. And it's something that we all need to make sure that we're working together as a community to address. And of course, we can't do it alone. We need resources from our federal partners, and that's partly what I'm going to be talking about. But at least we need to do the pieces that we can do.